diabetes, not realizing that their agony can be dramatically reduced or reversed by modifying their dietary habits. And one of the reasons that diabetes is the 7th leading cause of death in this country is that diabetics are much more vulnerable to atherosclerosis, or hardening of the arteries. They're more prone to heart attacks and strokes, and they live significantly shorter lives. But it's not just that diabetics live shorter lives, it's that the quality of their lives can be so profoundly affected. The blood flow to the retina, the back of the eye, can be damaged, leading to diabetic retinopathy, which is the #1 cause of blindness under the age of 65. The blood flow to the kidneys can be affected, so that diabetics have an 18 times greater risk of severe kidney failure. And many diabetics spend the last years of their lives tied to the ordeal of a renal dialysis machine. The blood flow to the extremities can be affected, so that an infection on a foot or a toe can lead to gangrene in some cases, and sometimes require an amputation of a foot or a leg. And this can even be fatal. And if that's not enough, atherosclerosis affects the blood flow to the reproductive organs. So diabetic males are much more prone to impotence. Now, for all that atherosclerosis does, most diabetics don't know which diets promote atherosclerosis and which diets help to reduce atherosclerosis. So most diabetics consume the standard American diet, and on average, 17 years after their diagnosis, will have suffered a significant health tragedy, such as a heart attack, stroke, kidney failure, or blindness. Now, type 1 diabetes, just kind of review real quickly, is a condition that occurs when the body makes too little insulin. It is an autoimmune disorder, and it has been linked to cow's milk protein. It has been stated that a genetically susceptible child that consumes cow's milk has a greater risk of developing type 1 diabetes than does a smoker of developing lung cancer. Now, type 2 diabetes, more common, is a condition that occurs when the cells in our body accumulate so much fat that they become resistant to insulin. Now, insulin is a pancreatic hormone that controls fat and sugar metabolism. It allows the glucose, the sugar in the blood, to get into the cells and allows fat to be deposited into the cells. Type 2 diabetes is not so much a disorder as it is an adaptation to the body getting too fat. It's as if the cells were screaming, "Turn off the insulin." Now, the reason this occurs is that as we evolved, when food was plentiful, there was a survival advantage to putting on those extra calories or carrying those extra calories in the form of fat to be used for energy when food was scarce. But in today's society, there is no lean times per se. We're overnourished. We have too many calories. There is no health advantage to carrying that extra weight. In fact, it's probably quite harmful. This is sort of a diagram of what happens with insulin and glucose. So the glucose is little blue round molecules, and with normal insulin sensitivity, that insulin allows the glucose to get out of the blood vessels and into the cells. With insulin resistance, though, there is no way for that glucose to get out of the blood vessels. It stays in the blood vessels, and our sugar levels rise. Now, the risk of diabetes does correlate to the type of diet we consume. A standard American diet has about an 8% risk of type 2 diabetes. Now, we'll sort of define some of our terms. A semi-vegetarian is not really an adequate category, but it describes somebody who eats less than normal meat and dairy products. A pesco-vegetarian refers to somebody who eats fish, but no chicken, beef, or any other meat products. Lacto-ovo refers to someone who drinks milk and eats eggs, but none of the other meat. And then a vegan is someone who consumes no meat, animal products at all. Now, studies have been done a long time ago. These slides were taken over 50 years ago showing what a fatty meal can do to the blood vessels. And this shows, these are the conjunctival blood vessels, the outer layer of the eye. And before a fatty meal, you can see the blood vessels are very thick. Come on in, we just started. You're more than welcome to find a seat. The blood vessels are very